If you're experiencing iron overload as the result of frequent blood transfusions, then you may be questioning how you can lower your iron level naturally. For a lot of people with sickle cell and thalassemia, blood transfusions can keep them well. However, the amount of iron that builds up in the body as a result can cause problems. And at this point, you're probably thinking, great, now I have to take more medications for this problem. And you're like, no, I want to try and handle this naturally. Completely understandable. But if this is your thinking, just take what I'm about to say into consideration. I'm a former doctor living with sickle cell myself, and I want to help break this down for you. So in terms of lowering your iron, you have the two options. So we have iron chelation therapy, which is a medication that can be taken as a tablet or can be given as an infusion. And this helps bind to iron in your body like a magnet and then helps it be excreted in the normal way, urine, feces. And then you have dietary measures, which aim to limit the amount of dietary iron you intake and block the amount of iron you absorb from food. So let's look at this example of someone with a ferritin level of 2,500 microgram per liter. So this person can take desferrosirox for 3 months regularly and expect to decrease their ferritin level by 100 to 300 microgram per month. Assuming everything else stays the same, this would mean they would decrease their ferritin from the level of 2,500 down to 1,600 to 2,200 microgram per liter after 3 months. So if we now look at dietary strategies, which is things such as drinking black tea with meals, avoiding vitamin C rich foods with meals, limiting red meat, and avoiding calcium and phytate rich foods. These all reduce iron absorption from food, but they can't remove the stored iron in your body. And since the amount of iron absorbed from food is less than 2 milligrams per day, compared to around 250 milligrams received from a blood transfusion, the amount of iron that you're avoiding by adjusting your diet is not going to make a significant difference to lower it overall. So essentially, after 3 months of dietary measures alone, that 2,500 ferritin result is probably going to be more or less the same. So what I'm saying is that dietary measures can help slow further iron buildup, but they can't remove existing iron stores. Iron chelation therapy is the only scientifically proven way to remove iron from the body and prevent organ damage. So anyone keen on using natural methods alone, this is not the area for that. So please make sure you're combining natural methods with iron chelation therapy.